Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about laxatives and your brain. It seems like they're not connected, but there's nothing that goes on in the gut that isn't connected to pretty much everything, but certainly the brain. We know that there's a direct gut-brain axis. So if your gut's not functioning right, and certainly if we use the wrong tools to try to fix it, there's going to be a price to be paid. So this was a study, very large study, looking at average age was 56 and a half, and they looked at people who had regular laxative use and their risk of dementia, whether Alzheimer's, vascular dementia, or standard dementia, I guess you could call. So the definition of regular laxative use was most days of the week in the past month. Unfortunately, there's a lot of people that fall under this category of using laxatives on a regular basis, and unfortunately, most people use the wrong types to fix a constipation problem, and we're going to talk about that in a second. And they found that those people who were regular users, 1.3% of them ended up with dementia, all-cause dementia. And that was compared to 0.4%, so about almost 3 times the risk of, or a little over 3 times the risk of somebody who didn't use laxatives on a regular basis. They found that the more laxative types that people use, the greater the risk, but also osmotic laxatives increase the risk. So what's an osmotic laxative? Anything that, when we take more than our body can absorb, the rest of it stays in the GI tract and attracts water. So it's one of the side effects of too much magnesium or too much vitamin C. And they will attract water, so it can loosen up the stools. However, there are other products like Miralax that are propylene glycol, and those are also osmotic, but those are chemical osmotic. So the body doesn't absorb it at all, so it's trying to just throw a bunch of stuff at the gut that the body doesn't want, and the gut's going to try to dilute it. So those are osmotic laxatives. So definitely a link between the use of osmotic laxatives, or laxatives in general, and brain problems. So this could be either the fact that somebody's constipated in the first place, and that's not good for the brain, or it could be the use of these laxatives is somehow toxic to the body. It could go either way. We really don't know, but the association is there. So what do we do if somebody's constipated? And Lord knows, constipated, like most people should be going to the bathroom about once to twice, sometimes 3 a day. And some people think it's okay to go every other day or every third day. It's not. Absolutely, without a question. So if you're constipated, we need to fix that problem. And a lot of times you look at things like exercise can be good for constipation. Increasing your fiber intake, especially soluble fiber intake. And that's I've covered that a lot in the past. Increasing fluids, so making sure you're staying hydrated. We personally prefer unsweetened organic tea when possible. And food allergies can be a big one in causing constipation. The dairy is high on the list as causing chronic constipation, but also prediabetes. The diabetic spectrum also slows down motility of the gut. In the meantime, if you want a short-term fix, I recommend magnesium, because what you're trying to do is overdose on magnesium. Magnesium in general is very good for the brain, so I would find it very hard to believe that taking magnesium to help with constipation would be bad for the brain. I think if we kind of tease those apart, we'll find that if we really need to use a tool to help with constipation, like that's high on the list of safe ones, and if anything, may actually help. So bottom line is, if you've got constipation, using the typical over-the-counter laxatives is probably not a good idea. Most certainly not a good idea, because it probably alters the gut bacteria in ways we don't want, and just a lot of different reasons. So fix the constipation with tools In the meantime, in the short term, use natural osmotic like magnesium to help fix and get stuff moving again so you don't feel like crap. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.